Good morning or good afternoon, depending on where you are. We're sitting here in St. Paul, Minnesota on a snowy day. So we're glad to be doing this by webinar because we think a few of you may have stayed home in this kind of weather. So my name is Amelia Frank-Meyer and I'm the CEO of ALEA. And on behalf of the staff and board at ALEA, we'd like to welcome you to the webinar on the unseen cost of foster care and talk to you today about the social return on investment study that we did with our partners at Ecotone Analytics. So as the CEO of ALEA, I just want to tell you a quick minute about what we're up to in the world and the perspective from which we commissioned this report, and a little bit about how it came to be too. So ALEA has been a nonprofit operating nationally and in some international jurisdictions to transform child welfare since about 2016. We are based in St. Paul, but we work in jurisdictions all over the country with innovative child welfare leaders to help them to transform their systems. We consider our work in two areas: evolutionary and revolutionary. Our evolutionary work is with partners to help them to stabilize their systems, to reduce turnover and enhance workforce well-being, to help get more children out of care back home with people who they know and love or to whom they are related, and to help them engage systems partners. We're involved in evolutionary work projects, which are ongoing 1 to 3 year projects in New Jersey, New York, California, Colorado, and Manitoba. In addition, we do revolutionary work, which is really about helping to design a new way of work. So ALEA is founded on a model of know better, do better, be better. And our work is around advancing the knowledge base in the field through commissioning pieces such as the Ecotone report, providing lots of education and training, and helping people to get to aha moments about the change that needs to happen. Our do better work is really about helping people walk side by side with innovative leaders and change agents to help them to do the work differently. And be better is really about, we believe when we connect with other partners and align our efforts and resources, that we will all be better. So we don't need to do this ourselves. We just need to work with our great partners to get it done. And when we do, the outcomes for children and families will be better. And so we're doing that kind of revolutionary work where we are building a better way of work for kids and families with our partners in Iowa, North Dakota, Wisconsin, and Maryland. What's important to us is that all children have a sense of belonging. We believe deeply in the human need for belonging and want children to stay with family whenever possible, whenever safely possible. And we believe it's almost always safely possible if we do the work in a different kind of way. And so we have been working, I'm sorry, I don't want to advance the slide. You're going to do that for me, Hannah. We have been working to advance the work based off of Margaret Wheatley's theory of change, which talks about systems having an evolutionary life cycle. We believe the child welfare system was born several decades ago and has met its current capacity. It's a mature system, and now is beginning to decline, meaning on every measure we can measure, we believe there's some improvement that could be made. And so the work of a system evolution is that once it hits its maturity and it's past its prime, it needs to really be intentionally put into hospice, and a new way needs to be built. And it is our belief and the belief of our partners that the current child welfare system was set up on a set of assumptions that we now know are no longer true or are less true than when we first established our way of work. And so it is incumbent upon us to work together to build a new way of work so that we can align our work with the current research and do better for children and families. We have come to believe that our work is showing that many of the ways in which we do work in the current way of work in foster care creates in many cases, more harm than good, that we've gotten to a place now where the cure is, in many instances, worse than the disease. And it turns out that the Ecotone Social Return on Investment study has confirmed a lot of our thinking and fears about that work that we have done with kids and families. So we began to ask ourselves, what really is the true cost of foster care? And we are seeing the cost from the research on a social, emotional, spiritual, psychological, health perspective, and we're wondering, what are the true financial costs of foster care? And we began to ask that really because understanding that would help us to understand what we were investing in a system that we believed was not furthering the best interests of children and families in many cases. And so we were introduced to Ecotone Analytics by a board member of ours. They are a Minnesota-based organization that offers evidence-based valuation of impact. So for the dollars invested, what do we get in return is really the question. And so we started asking, for the dollars we invest in foster care, what do we get in return? And the Moxie Foundation, which is based in San Diego and funds a good deal of innovation across sectors, was an early supporter of ALEA and agreed to fund this report. And so Moxie has been an underwriter of the work, and we're super thankful to them for this opportunity to see these numbers. I want to introduce to you and pass on to our friends from Ecotone Analytics so that they can get to the meat of the report, which you're very likely interested in hearing. And so to introduce directly to my right is Will Nielsen, who joined Ecotone in May of 2018 as a data analyst. He comes to Ecotone from the World Bank, where he did analysis on the policies to support economic inclusion. He's got a passion for impact analysis, and he is a student of applied economics. And then directly to Will's right is Tim Roman, who's a co-founder of Ecotone Analytics, and he founded Ecotone to make social and environmental impact transparent and easily consumable for shareholders and stakeholders. So they take this array of complex information and data and put it into digestible and visible formats so that we can see the impact of what the investments are bringing us. So the Ecotone team is constantly researching, developing, and engaging in a philosophical evolution of utilizing capital to achieve sustainable, substantial social change. And so our experience with Ecotone has just been really fantastic. They have dug in wholeheartedly to this work and really learned what they needed to provide this comprehensive analysis. And what we are learning from the research is that child removal from their family, that separation of that relational connection, creates predictive lifelong future harm, not only for that child, but for generations into the future. We have negative intergenerational impacts. And so understanding the true cost of our investment in this work becomes incredibly important so that we can begin to imagine together what we might be able to achieve with those savings if we did the work differently, what we might be able to do with that resource that we're currently investing, which is producing, as you'll hear in a moment, negative social return on investment. So the more we invest, the less we get, the more harm we do. And what good might we do together in the world with those resources to advance the good for children and families? And so I'm going to hand this over to our partners, Will and Tim here, and have them share their methodology and get into the meat of the report.
Thank you, Amelia. Like Amelia said, Ecotone Analytics does evidence-informed cost-benefit analysis using available research and basically combines social science with applied economics. We took that to another level by adding data visualization to make the findings more understandable. And so on the next slide, this is one of two work outputs for this project. And I'd like to just walk you through it for a second so you can understand what the visualization is doing. So on the left side, if we're reading it from left to right, you'll see the costs and the assumptions. And then the middle section is that return on investment, although in this case, we've analyzed the negative outcomes associated with child removal. And then on the right side, you can see how the bands of value flow through to the different stakeholder groups and the proportion of value, or in this case, negative value that's accumulating to those different stakeholder groups. And then at the very top, we have the social return on investment broken out, totaled for the system, and then broken out for those different stakeholders. Those are also, when you say return on investment ratio, for each dollar spent, there's negative $3.64 in negative quote unquote negative benefits. That also, in another terms, you can think of that as a multiplier, like a 3.64 multiplier for those outputs. If you go to the next slide, we did two different scenarios for this project. And Will tell you a little bit more about what the two different scenarios mean when he gets into more of the details. But this one goes over the course of 3 slides because the negative outcomes were so large. So if you can kind of flip through to those. So you can see that we needed 3 slides to capture the scale of those negative outcomes in the worst case scenario. The purpose of this analysis was to shine a light and put some value behind of what these outcomes are, and to show visually to whom those benefits or negative outcomes accrue. This is, there's always controversy about doing cost-benefit analysis when you get it down to the penny, but that's really from dividing by numbers that it gets that fine-tuned. So I'm going to turn the mic over to Will, and he's going to walk through the methodology.
Great. Thanks, Tim. So to begin this analysis, we had to first map out this theory of change for the foster care system. And this is just the planned, in this case, theory of how typically we would think positive benefits and positive impacts will be accrued through the foster care system. However, as a result from our research and discussions with the ELIA team and other external stakeholders, it became clear that there are significant unintended outcomes and impacts that are accruing throughout this theory of change process. And so those became focal points for our analysis, and they end up becoming the points where we're able to attach the monetary value for the negative outcomes. So to give an example, this is many of the unintended long-term outcomes that we note here. In particular, we'll see how reduced earnings end up accruing to former foster youth, increased rates of criminal activity, and so on. And so in order to answer this initial research question of attaching the monetary value, and based on our theory of change map, it became clear that there is this very wide range of potential foster care experiences that could accrue. And so in order to try and better account for that range of experiences, we thought it would be better to show 2 potential scenarios. And so these are a combination of being informed by the various external literature, the types of data quality that's available. And so with that, we established a core set of assumptions for each scenario. I won't go through each of them, but in general, we have scenario 1, which is meant to be sort of a more typical case. And the second one is generally the worst case, or in this case, is mostly accrued to foster youth who age out of care. And so with that comes a variety of additional long-term unintended costs. But so as a part of any cost-benefit analysis, we have to establish the costs. Within these, we take a conservative approach. In many cases, costs could be much higher throughout these instances. But in general, we establish a average cost per child per year of around $32,000. Once we have established the cost, then we start focusing on how we can monetize the long-term outcomes. So in this slide here, we show they're labeled the marginal cost, and this is just marginal in this case refers to cost per child. And in both scenarios, we're comparing the cost accrued from each child to what would have happened in general population. So in this case, for example, looking at lifetime earnings, we're looking at $50,000 or $450,000 worse than the general population average. And so that is the methodology used throughout here. I'll just note then also that there's 2 additional outcomes that are also accruing in scenario 2. And we note these because, well, we work under the assumption that an additional 2 years in foster care would not accrue under a well-operating foster care system. And then built into that aspect of additional years in care is the often situation of overburdened caseworkers. And once caseworkers are overburdened, they tend to have higher turnover rates. This can lead to a slew of additional costs and also lead to worse outcomes for the foster youth themselves. So based on those costs, to give an idea of what this means when we aggregate these across all the children in foster care, the numbers get pretty significant pretty quick. So using a couple of different resources, there's various ways to estimate how these costs might aggregate over time, but going with the smallest figure for scenario 1, we're looking at about $23.8 billion in future social costs accrued each year. So this is just compounding year after year for each of the children that have a scenario 1 experience. Obviously, the case gets much bleaker when we look to scenario 2, which, while it is based on the children who age out of foster care, it is significantly worse. And so even using the fewer number of children that age out of care each year in proportion to the total number of children in care, we're still looking at least $17 billion in negative social costs accrued each year. But depending on how you understand the negative consequences of each scenario, that number can get inflated quite rapidly. And so in this case, we're looking at over $100 billion in social costs accrued each year. From there, it's important to note then also, throughout this analysis, there were some limitations in terms of data quality. Notably, we're limited in the types of longitudinal studies that we can track in terms of seeing what happens for each foster youth over time. In this case, we would really like to see what happens years and years after they've been in care, even if they're only in care for a month at a time, or even those shorter cases. But so to give an idea of the types of outcomes that, in this case, we were limited and weren't able to monetize, there's a slew of negative outcomes that are well discussed in the literature. So we know that they're there and prominent and important, but putting a dollar value to them has not always been very straightforward. In addition, then, the 2 main positive outcomes that we would attribute to a well-functioning foster care system are these avoided cases of premature death and suffering. Those are also instances that in this case are not included. So now that we've gone over all the different steps we took to get to these visuals, I'll just quickly revisit what Tim already touched on. But in general, in scenario 1, a well-functioning system, we're looking at negative returns of about $3.64. And this is aggregated across the multiple stakeholders. And in scenario 2, then, gets much worse. The big difference, as you've probably noticed in the visuals, is largely through the lost income. And in this case, the lost future income can account for many other potential negative events that are occurring in the former foster youth's lives. We take this loss in income to be representative of many potential things. While there may be other costs accruing in these other outcomes that I know are too small to read in this map here, but we take that approach just to make sure that we're not double counting negative costs. And so we assume that negative costs that show themselves in earnings could be instances of substance abuse or rates of incarceration, and so those can all be captured in that. Then just based on that, I'll touch on a few major points that I think are important for understanding this analysis. For the first 2 points, that's just regarding the data that was used. So as I mentioned, there's definite data quality issues, especially for scenario 1-like experiences. And so within scenario 1, we had to use a mix of data sources. The first, and this is one aspect where there's a little more literature, is the long-term outcomes of children who suffer abuse and neglect. In this case, we assume that they would have similar experiences as a foster youth, given that those will be major reasons for being removed from home in the first place. The other is the very limited evidence base, but it has been tried in a couple cases where they look at the effect of a child who was removed from home for a given instance of maltreatment versus a child who suffered a similar instance of maltreatment but wasn't removed from home. And in a couple cases where those studies have been implemented, the child who was removed from home but suffered a similar amount of maltreatment did worse on average, and so that helps inform this analysis as well. As I mentioned, for scenario 2, we looked at children who aged out of care, so that became the basis for valuing those large negative outcomes. And so given this data quality aspect, there is always this potential issue of understanding how we can attribute the negative outcomes of foster care or to the foster care system, rather than if there's other aspects of the children's lives that are already going to potentially predispose them to worse outcomes than the general population. And then last there, we wanted to note too that this analysis isn't taking account of the large racial disparities that occur within the foster care system. And that's largely based on the lack of data that we saw in order to be able to incorporate that. So going forward, that will be something that we can hopefully revisit as the data becomes available and make clear how this SROI differs for the different racial groups. Let's see. So last year, I'll just touch quickly on a couple concluding recommendations that we came across. The first is the general avoiding removal from home in the first place. In some cases, that might not always be possible, but if there's various protective factors that we can implement in terms of supporting the family first, so that the child remains in home, that's most likely to lead to better long-term outcomes for the children and likely for their parents as well. But so if it does occur where the child is removed, it's best to shoot for maintaining these recommended KPIs. We didn't discuss those too much, but those are built into the report more, and these are things like reducing the amount of time in care, minimizing the number of placements, and so moving towards permanency as quickly as possible.
And KPI is key performance indicator.
Yes, thanks.
Just for those.
And so on that same line, if the child is removed from home, given the scale of these negative outcomes we've seen, there's definite opportunities for supplementary programs and protective factors to be put in place to help boost those long-term outcomes. So those can be geared towards both the foster youth or their families. This relates to our first bullet point there. And the last one here is just given what we've seen with the current foster care system, is the need to study and discuss alternative options to the foster care system. So generally, just as a final takeaway, I'll note that what we saw is that treating the symptom, which could be abuse and neglect in the home, by disrupting the natural system of the family, unsurprisingly led to these pretty large systemic changes in the child's life and their families as well. So that's an aspect that, because we focus on the child-centric view of what that means for the child, there's this potential spillover negative cost that accrues to the family members as well. So those are all things that can be accounted for going forward. Then as a last note, throughout our work with Ecotone, we always align the analysis with the United Nations Sustainable Development Goals that I touched on. one thing we were impressed by with this one is just how many goals were addressed through working with the foster care system. So to give you an idea of scale too, there's 17 goals, and this hit almost half of them. And so for us, it was eye-opening, and just how many facets of life can be incorporated into childcare. And from there, I'll pass it back.
Okay. So this really starts to beg the question then, we have to begin asking, if this isn't working, then what do we do then? And as we pass this initial report out to several experts in the field, one of them, who is a behavioral economist, wrote back and said, I don't really get it, because what this report says is it would be better to do nothing. And what we replied is, right, and we can't do nothing, right? We can't leave kids home in abusive and neglected environments, so we have to figure out something else to do, because what we're seeing on virtually all indicators available through the longitudinal research that Mark Courtney has done and others, and through the social return on investment analysis that Ecotone has done, what we're seeing is that we can't continue to do foster care as we know it, right, as it exists today. We are not able to do it from the human cost. We're not able to continue to do it sustainably from the financial cost. We have a nationwide chronic shortage of people who are willing to care for these children who are unrelated. And so we really have to begin getting busy about building a new way of work. And so as part of that, Aaliyah in May of 17 brought together 100 innovators from all over the country, 10 from tribal and federal child welfare, 10 from state child welfare, 10 from county child welfare, 10 child specialists like psychiatrists, psychologists, etc., 10 folks with lived experience, and which ended up being 40 of the 100 because they were also running systems and involved in other ways. So you get the idea. We had 10 tables of 10 and engaged our partners from San Francisco IDEO, who are the leaders of human-centered design in the country. And so they helped us to answer the question, if not this, then what? What do we do instead? And how do we rebuild a better child welfare system? And what came back was, you're asking the wrong question. In fact, you don't want to build a better child welfare system. The perfect child welfare system, when it works well, already exists, and it's called the family. The challenge is that sometimes families struggle. And so what they really brought back to us was the idea of, instead of rebuilding a new child welfare system, you need to kind of unbuild it and get back and closer to families and communities, and trust the wisdom of children and families to design their own futures and meet their needs in a more local way. And so we have called this concept the unsystem, which is really around putting whole families at the center, not just a child-centric view, really focusing on building in resilience and joy, well-being, and health for families and for the workforce, having culturally specific, locally delivered, supportive, consistent services for children and families. And so focusing at this point on reducing or eliminating out-of-family placement. So a child may need to immediately come out of the home when they're not safe, but can we put them with someone who they know and love or to whom they're related? Or more importantly, or better yet, what do we need to do to support families to be able to safely care for their own children? And so this became the key question is, instead of how do we build a better child welfare system, our key question is, what would it take? What would it take to keep children safely at home in their own family? Or what would it take to help families who are struggling? And what we really love about this is the presumption of possibility is taken out of the question. We assume it's possible, and now we begin to strategize on how to make that happen on the ground. And so as a result of looking at this, we were looking for brave, innovative leaders who were at the top of the innovation curve, our early adapters and innovators who would be interested in trying to answer this question in practice, because we really believe we have come to the end of what we can know and learn by thinking about this, by having committees about this, by establishing task force to look at this. We really need to begin now working with children and working with families to help them to solve these challenges and to bring forward a new way of work with them in engagement and alignment that says, what would it take? What do people need to be able to do this? And how do we help families who are struggling to safely care for their own children? We put out a national call for that, and we were lucky to have several systems respond, and in the end put together the ALEA Innovation Cohort, which is made up of 4 states, 14 jurisdictions, 5 brave leaders and their seconds, their deputies, their support. And they have been working for about the past year, coming to ALEA in St. Paul every month, month after month, to develop and implement new ways of work on the ground. So they all go back and they try new things. They come back, they teach each other about what they've learned as they have performed these experiments that we call hacks to try to get closer to their joint aspiration that they have set. And their joint aspirational goal is family connections are always preserved and strengthened. And that means no matter what we do, that our work supports that sacred relational connection of family and tries to strengthen those bonds while keeping children safe and keeping them with people who they know and love or to whom they are related. So they are on the ground answering the question of what would it take to do that. You know, we know that sometimes children have to be removed from their parents for imminent safety risk, but we also know from the research and from the data that the minute we do that, we are in fact creating an adverse childhood experience, and we are setting them down a trajectory of untold predicted future harm for them and for future generations. And so we are talking about ways to safely avoid that whenever possible, and we think there's just so much more we can do. To that end, we have published the early outcomes from the cohort in the ALEA Innovation Cohort Report, and they started meeting May of last year virtually for the first few months, and really not in person until about July. So the report reflects 3 months of work, and the outcomes will be very surprising to you, maybe. We believe that we already know what to do, but we're not doing it. And so once they started to do it, and we meaning the collective and child welfare people who think about this work differently, once they started to implement, the outcomes showed really significant shifting early on, even after 1 quarter, so 3 months of implementation. And so we really invite you, the link is in the chat, to download that free report and read more about that. I want to be really clear that we are not pushing a singular model, that we are not talking about the ALEA way of work or the ALEA model. There actually is no such thing. We think we can get to this end in many ways. There are so many great models out there that engage families, that work in different ways that are about healing instead of disconnecting or punishing or shaming. And so instead really thinking about coming together in partnership with children and families to help them to design their futures together. And again, lots of different ways to get there. And so as we're at this point in the webinar, we still have several things for you, but we want to take a pause here and begin to answer some questions you might have, really inviting you to put questions in the chat box and ask what you have for me or for Ecotone, or things about the study or what we're up to. So does anybody have any questions to start? And there is one here in front of Will for a good question, and then I have one next, it looks like. So.
Sure. So I can read out this question that came in, and it was, how do we know these negative outcomes aren't related to the abuse and neglect itself? Yeah, that's a great question. And I think to an extent that's something that the studies are still being done to get at. What we know, and particularly with scenario 1 that we discussed, is that there's a couple leading studies that simulated the similar levels of abuse and neglect across children. And so these children were paired off, and one of them was removed from home, the other wasn't. That child that was removed from home consistently did worse. within that, those studies are difficult to pull off, of course, because it's hard to say the exact same level of maltreatment was experienced by these two different children. But these few studies that are out there within that regard have been able to show that that was the case. But of course, I would say it's definitely something that is deserving of future study as well.
There's also a question in the chat about, does the Family First Prevention Services Act factor into your report? If so, how so? And not yet, because it hasn't yet been implemented. It's a new piece of legislation that allows for the flexibility of funding to do some of the things that are recommended by the report. So to use some of the dollars we have traditionally used for out-of-home care to be used in a way to support prevention, which is what the report is recommending. So in that way, they're very, very connected, but the implications of Family First isn't in there because that isn't yet fully implemented, nor has it been studied, and so that research would not yet be impacted by what we're talking about. So I would say the way they're connected is the correlation between what we think should happen, what the research says should happen, what the report is recommending should happen, and creating the flexibility and funding to allow those things to happen. But the data and research is not yet available on Family First, as it is new to us, to all of us, and not yet in the research. Other questions? So this one says, if you are interested in the what would this take in practice, how do you follow up? So if you are interested as a viewer on what would it take and how do you follow up, I'd say the first thing to do is to go to the ALEA website and download the innovation cohort analysis report of our early outcomes. That'll give you a really good idea about answering how we're answering the question, what would it take? We'd invite you to also email us at info@aleainnovations.org, and we can speak specifically about the ways in which you'd like to follow up about that. But the innovation cohort early information is available in a free report on our website. And then another question is, the assumption is we are risk averse. What does it take to tolerate risk and view families differently? Yes, so I really love that question. It's no surprise. It's from one of our innovation cohort members. Thanks, Chuck, for that. Actually, I have in my notes to make sure I answered that question. Nobody asked it, and Chuck is not a plant, and so it just worked out well. So I think we have some very challenging discussions to have, not only in our field, but societally around the risks that we are willing to take. Because the truth of the matter is we can never eliminate all risk. It just is not possible to eliminate all risk for children and families unless we want to have 24-hour surveillance or put cages in homes, and even that creates its own set of fundamental outcomes and risks, right? So you just can't do it. And so the questions that we need to be talking about is how do we share risk? How do we reduce risk? What is our risk tolerance? And what we know for sure is severing relational connections and placing children out of their home, especially with people who they don't know and love or to whom they're related, we know for sure that that has negative impact, consequences, and outcomes. And so in an attempt to reduce risk or eliminate risk, which we know elimination is not possible for a few, we are knowingly causing predictive future harm to, frankly, hundreds of thousands of children. And so really dealing with this question about sharing risk, risk tolerance, reducing risk is, I think, a question in our field, in our communities, with our neighbors, with our representatives, that we need to have a bold question about, a bold conversation about to what end have we tried to eliminate risk which cannot be fully eliminated, and what harm have we caused in doing that? Are there other questions here? So this one is, when I look at the amount paid to foster families, I have wondered whether we would get better outcomes by paying that to birth families to stabilize them and help them better provide for their kids. Are any of your innovative jurisdictions experimenting with anything like that? So there is some effort really to transfer foster care payments to kin, to be able to pay them in similar kinds of ways for kinship placements. But at this juncture, we do not have any jurisdictions who are, as a matter of prevention, directly funneling what would have been out-of-home care, foster care supports directly to families in a way of doing prevention. That is something that I've heard lots of folks in the field say that I think is definitely up for investigation, but would require a very significant shift in not only regulation, but in our cultural mindset around that. So we have a whole lot of, why would we pay people to take care of their own kids? You know, that doesn't make sense. I want to get paid to take care of my kids. Maybe we should act in ways that would allow us to get paid. So we have some mindset work to do around that before we're able to do that. We do have friends with an organization called LIFT, which is in Chicago and on the East Coast, who are experimenting with UBI, so a universal basic income. They're experimenting with how do we give a family stipend to see if it can lift them out of poverty with just basically direct installments of resources. And so they are in the early stages of that work, but we are not doing it as part of the child welfare piece of work.
Two questions for these guys. Go down to Tiffany and John.
Okay, and we're looking here. You speak a lot. For you? Want to read that out loud?
Sure. So the question is, you speak a lot about comparison to the general population. Please talk a little more about this, because it seems our kids in foster care come from a specific population, i.e. poverty, abuse, neglect, etc. Yeah, that's a good question, certainly. I would have to say in this regard, I think that's a good point, and definitely something that would be interesting for a future study. So if we could take, let's see, like census tract level information to start to isolate the average conditions by the areas where kids are from, we might be able to get a more fine-tuned estimate of what that SRY could look like that would be more specific to the local population that they're coming from. But yeah, for ours, it's more broadly speaking, it is general population figures. Hope that answers your question.
And John, Katie, in review?
In your review of the literature, did you find any similar analysis that showed different results than this study? No. I guess that was an interesting aspect for us too, because since we're not the subject matter experts in this field, we have the methodology that we bring to the field. And so for us, it was a recurring theme throughout that on average, there isn't this net benefit that we would hope to see within a large-scale social system like this.
Do you see another question, Katie, that we should answer?
A couple. There's a little bit more about Families First Act and interpretation.
So this one is, one problem seems to create confusion is that counties are allowed to interpret laws differently from other counties. Is there a way to make the interpretation of laws uniform for every county? And so, you know, that's really a legislative process and a state regulation process. So in state-run, county-administered systems, that would be at the area of the state level, but it's kind of outside of the scope of what we're looking at and studying. And so, so just the idea of if counties are doing it differently, you know, that would be something to elevate, I think, to your state Department of Children and Families or Health and Human Services. We just really kind of take into account, and that's why we don't have one way or one model, because we work in rural areas, we work in urban areas, we work in areas where, you know, meth is a huge challenge. We work in areas where unemployment's a huge challenge. And so just sort of meeting people where they are despite the application of laws and what the environment is, to design those interventions in community-specific ways. So that's how I'd answer that one. How do we reduce the paperwork required by caseworkers, which allow them to spend more time building relationships with the families and foster parents? Oh my goodness. So this is related to my dissertation topic, actually, because it's part of what I studied, because our workforce is diagnosable on any given day, 40% with secondary traumatic stress. And people think it's because of the hard things they're seeing with kids and families, but in fact, it has way more to do with your question here about paperwork and time spent with computers and forms and regulation rather than with people in relationship. And so that's a really key thing. We have become extremely bureaucratized and regulated, and that's why one of the reasons why we talk about the unsystem is getting back and closer to the relational connections and doing the healing work in direct proximity with children and families. So it's a really important thing to continue to raise. I will offer to you that the research is incredibly supportive of your framing that we need to get back to our relationships. And I have a thick dissertation if you want to read that, or would like the reference list for substantiation of your thinking. I'd be happy to pass that along to you too. Chapter 1 is thrilling on this topic, but you're right on. Are there other questions, Katie, do you see?
The last is a comment about a federal interpretation, but you might also want to comment about Jerry's new vision of child welfare.
So there's no oversight of the departments or courts, which is why foster care has become a trafficking industry. The federal government has made it an incentive to take kids. There are children who need care, yes, but the vast majority of those kids in the system have been removed without any imminent danger to life or health. And so I would really offer here the perspective that there is very little incentive in the front line to leave children in care, if there's any doubt whatsoever, because we have really punished our frontline workers and held them deeply accountable, send them to prison or prosecuted them for instances such as this. So this goes back to an earlier comment that I had about having a hard conversation about how do we share risk and how do we get comfortable with what level of risk, knowing we can't eliminate all risk. And so I think Family First is really an important piece of legislation that moves to not have to take kids into custody in order to get them the services that they need. Jerry Milner, the Assistant Commissioner of the Administration of Children, Youth, and Families, has been traveling, crisscrossing the country, really stating very clearly that foster care should be rarely used, and when used as a support to parents, not as treatment for children. And so I do think there's a signal federal shift with Family First and with Assistant Commissioner Milner really saying that explicitly and clearly in venues all over. And so I do think that there is movement in that area, but the question of incentive is a very important one, and how services get reimbursed and what activities are tied to that in our current structure and funding is a very, very important question that we need to continue to raise. There's another here of, it seems as though kids who live with relatives in foster care do better than kids who live in community homes in foster care. And the idea of living with relatives has been around a lot longer than foster care. And that's right, Ashley. The research is clear that that kinship or related parents are able to handle more significant behaviors for a longer time. They disrupt less frequently. And so the research is clear that children fare better when they are with people who they consider to be family. Is there maybe one final question?
I think we could ask the question, what are their ideas and how they want to share, and then just maybe wrap up with that.
So Yeah, I think it's important to note that the Family First Preservation Services Act isn't a tool or a model. It's not a vision. What it is a flexibility in resources to allow us to implement the change in mindset. So if we think differently about foster care, if we think about a new way of work that is engaging families earlier in a primary prevention kind of way, really supporting families, not just children as individuals, but families as an ecosystem, noting that children don't really, you can't pull a child out of a system, provide them treatment, and put them back and expect anything to change, that we really need to support that ecosystem around the child. Family First was designed really to create flexibility in funds to allow us to implement that mindset shift, but in itself is not prescriptive. And so it's super important for us to think differently about this, to think about different ways we support families, and then to use Family First as a tool to implement that vision, getting work on that together. So we posted a question to everybody. We're wondering what your ideas are on how we can use this report, who else should hear it. It is free and downloadable and forwardable, and we would just love for you to get it to as many places as you can. We have recorded the webinar and are going to post it and have that available for people if you want to send that on to others, and really appreciate you sharing that too. We have a few more things that we want to get to here before we let you go.
Let them answer this question, and you can
One more question. Go ahead. What is, or what percent?
What percent of children would you say fall into the best case scenario? It's not often that a child achieves permanency/reunification with no additional investment beyond basic maintenance, payments, caseworker, healthcare, court costs. Yes. I might have to look back at the numbers.
That's something we can post.
Yeah.
We'll get the answer to be sure and go back and take a look at that, and then we will post that. So, and then continue to post your ideas. We'd love it, and would love your help in spreading it. So we wanted to leave you with a call to action about what can you do now, right? What are the things that you can do? Because we want to just sort of acknowledge and say that these numbers are not just numbers, they're not just outcomes. They represent the lives and experiences of real kids, real youth, real children behind every number here. So this lifelong negative return, these lifelong impacts, this lifelong loss, you know, that dip in the curve, those represent kids, lives. And so we want to really just bring us back to that. And also, what can you do now is, the first thing you can do is really learn more about trauma, talk more about trauma, learn more and tell people about the impact of family separation and how incredibly harmful it is to not only children, not only their families, but to communities, to us as a society. That is the fundamental building block of our connection and our ability to connect throughout our lives with people. So it's incredibly important to understand that. We'd love you to just promote policies and laws and candidates and discourse that value family preservation and family connections. If you would please share our report with anyone who you think might benefit from reading it, which we think is everyone. So if you could pass that on to your network, or post it on your LinkedIn page, or share in your social media, we just so love and appreciate that. Or send a specific note to your legislature asking them to take action as they read the results of this. We also would love you to download and read our case study on the innovation cohort and our early outcomes there. And if you are a funder or a philanthropist, to consider the results of the social return on investment study and your funding decisions and other decisions, that we are in a place where a new way really must be built. And finally, some other pieces of action that we are hoping you take are staying in touch with us. We would love to ask you to live out an ALEA value that we have, which is do what love would do. So we'd ask you to promote and think about and talk about, for a child who is yours or a child you love, a niece, a nephew, a neighbor, a student, to do what you would want to have done for them, and thinking about it from all our kids. So if you text at the number on the screen, we'll sign you up for our newsletter, or you can go to the website. We have some next level learning, so really advanced learning on some of these topics, and innovative summits coming up. There are 10 of them this year for judges, for advanced practitioners, for innovative leaders, women in child welfare, lots of those, and we'd love you to explore those, and would love to see you in St. Paul for some of those as well. So that is what we have for you today. We want to be respectful of your time. We're going to hang out for a little bit here and continue to read the chat and take those ideas that you're sharing with us about how to share this report and this information, and could not be more thankful to you for your time and attention today to what we think is a really important perspective on the work that we do. So thank you for all that you do all day long to help advance this kind of work with children and families, and for your interest in the topic. And thanks to our partners and friends at Ecotone for their amazing work on bringing this new perspective to us, and to the Moxie Foundation for your support. Have a great afternoon.
Thank you.